In this episode, we interview Chez Smith, founder of Gyrls In The H.O.O.D Foundation, an organization on a mission to increase positive reproductive health outcomes amongst adolescent females residing in urban areas considered hood. Awesome. Well, thanks everyone for tuning in to this episode. Today we have Chez Smith, who's the founder of Gyrls In The H.O.O.D Foundation. Chez, thank you so much for your time this afternoon. I had to look at the clock.
Thank you for having me on. I'm excited. Happy to be here.
Awesome. Me too. So per usual, we like to start with just a mission statement. So what is the mission of Gyrls In The H.O.O.D Foundation?
Our mission is to improve reproductive health outcomes amongst adolescent females residing in urban areas considered hood, and to redefine the negative stereotypes that are placed on girls based on their zip code.
All right. Now we're going to get into the details of what you just said. But before we do, why you? Why is this something that you wanted to found?
My background is in public health. I was an administrator over at Francis Health Center, the Family Planning Clinic, which is like one of the largest family planning clinics in the Midwest. And we used to get, during my time there, we had a lot of girls that were coming in, for just negative health outcomes, whether it was sexually transmitted infections, unintended pregnancies. And I had an opportunity to meet with them and talk to them in my role. And I just realized that a lot of the girls were just not receiving adequate sexual health or reproductive health education, if any at all. We were seeing that a lot of girls were getting information from maybe big cousins or, their partners and things like that. And that's not always the best source because it leads them to believe a lot of the myths that are floating around about certain topics. So when I left there, I was like, let's see what I can create to kind of get to the girls before they make it to the clinic. Because when you think about it, like some of the topics that we discuss is not talked about like in a meaningful way, like in the schools, in the households. There's still a lot of stigma and judgment when girls are wanting to talk about their bodies. It's a lot of double standards because if a boy came to their parents and said, hey, I'm thinking about having sex, somebody might give them a condom and pat them on the back. But if it's a girl, it's this judgment that starts to circulate. So I created the Degrees Before Diapers program to kind of and start hosting that program around the city. And that's the way Gyrls In The H.O.O.D Foundation got started. So I wanted to because I just think that it's important for young girls to receive education so that they can make informed choices and learn how to navigate in the healthcare system, right? It was a lot of times I would see girls coming in and they were judged, and so they sometimes would leave, or they didn't know that it was steps that they could take to stand up for themselves, that they could ask for the patient advocates or anything like that. And that's good to learn now, because as the girls blossom into women, there's going to be many times where they're visiting a healthcare provider, and we know that like with some things like maternal mortality rates and things like that Black women are at a higher rate or are dying during pregnancy or childbirth or postpartum at a higher rate than anyone else. And so learning how to advocate and speak up for yourself is important. So
and is that due to access to healthcare or education or a combination of everything? I'm curious
it's
as
a
to
combination.
Yep.
A combination, and studies are showing like it doesn't, and racism in the healthcare system, whereas our concerns are easily dismissed, where if you have someone else come in and they say the same things that people are going to run tests, screenings, exams, but for us it's like they think that we have some higher pain threshold, and some of these things are actually there's been studies around this that show it doesn't matter the economic factor, your class, is just coming down to race. And we've seen like even high profile celebrities. Serena talked about this, Serena Williams, when she was pregnant. Beyonce talked about this. Like this is something just affect us all.
Yeah. And you mentioned it already, but I think I read an article, or I saw a title of an article, or in somewhere I came across that it is disproportionate and it is racist in terms of the diagnosis of painkillers, of the pain threshold. So basically, if a white woman were to come in, or a white man were to come in this case a woman, they were facing less amount of pain in order to get prescribed certain painkillers versus a black woman. So yeah, I think I saw that too recently. It's really sad that that's a thing. Do you feel that a lot of the work that you're doing to help educate the younger women will also trickle into the broader health system and health care impact to Black people, in this case specifically women, or is it kind of focused right now on just the younger women that you're working with?
Well, I think that like when you educate girls, like you're really educating a community. Like even in our households, women kind of influence a lot of things as it relates to doctor's appointments, the things like that. And so I think by educating girls now, and not just like how to advocate, but just knowing themselves and knowing their body, the female anatomy and all of these things, you're just making for a better, well-rounded, educated girl now, but woman later, who's going to also influence her household, who could teach her daughter and break that pattern of, not knowing or not being able to have an open dialogue in your home or in your community about your body and things that, that you want to know related to that. Also, I think that some of those girls, they may go on to pursue medicine or different careers in there, because they'll see the issue just like I see the issue, and they can do something about it. Like they can have an influence within the healthcare system itself. So I think that by educating them, like it can just affect the community and society in so many great ways. I really don't see a downside to that. So whether it's in your household, whether it's in a workplace, maybe they'll have a Girls in the Hood Foundation type of thing going on, and they'll educate the next group of girls coming up.
Yeah, absolutely. So you mentioned a couple things in your mission statement. You mentioned the term negative stigmas, and also you mentioned that there's a lot of myths that have to be debunked. So I'd love to hear, what are some of those negative stigmas and myths that your programming helps educate the young ladies that go through your program is?
Well, as far as like the stigmas, when you think about some of the communities in Chicago, right? When you think about anytime somebody is warning someone about coming to Chicago, like don't visit Inglewood, don't go into Roseland, but how do you think that make the girls who live in these communities feel? It's saying like, this community and everything in it is inferior. And that's just not the case. Sure, there's trouble in these communities, but there's also good. There's a lot of good, and so we work with girls to kind of help them take that label off of themselves and know, that you have the potential to do anything in this world that you want and that you work for, of course, and so that's what we push through the program. So just helping with that. And then as far as myths are concerned, just, if they're not getting the education, they're just going to start making up stuff, and people's like, well, why don't they Google it and all of that stuff? Yeah, well, they don't. Some may, but a lot of times there's nothing like having a one-on-one conversation, especially like getting into the nitty-gritty of some stuff you just want to know. So, sorry. So yeah, I think so. Some of the myths that we've heard, like I had this girl, she was a student at one of the schools, and she's an honor roll student, great girl. And she and I would have a conversation. She was like, well, I started having sex with my boyfriend. She's like, but don't worry, because we have sex in his truck. So I'm like, and okay.
Where is this gonna go? Yeah.
Yeah. So she was like, well, if you have sex in the truck, you can't get pregnant that way. And I was like, oh, I'm like, who told you that? The boyfriend had told her that. And so this is what she had been doing. And she ended up getting pregnant. So, I mean, just myths like that. And you don't think that, someone is intentionally trying to mislead you, although sometimes that can be the case. But if you don't know, you're just going to keep passing that information on. So that's where our organization come in.
All right. So degrees before diapers. It sounds like this was kind of the inception in the start of a lot of the Girls in the Hood programming. So what are some of the main topics that you're covering within this program? And we didn't even get to the when. Like when was this organization founded? And I'd love to hear how it's grown since then.
We founded it in 2017. So that's when I actually incorporated everything. But prior to that, like I've always just held workshops, even in the capacity in the clinic that I was working in,
Yeah.
things like that. But degrees before diapers, like some of the topics that we cover, consent, mindset. And that's a really huge one. Like we started off with the mindset matters because you can't really, you have to have your mind right to make responsible choices in the first place, right? So we connect girls with mental health services. If we see that that's what they need. We also cover things like we do post-secondary guidance within the program. So where are you going after high school? We create a plan. Don't just tell me that you're going to Spelman. Like, what's the GPA? What do you have to do to get there? What's the financial aid package? Where are you now? Like, really like putting that together for them. Then we talk about birth control and, prevention methods and things like that. So it's a well-rounded curriculum. We have a financial literacy piece in there, do a college tour, things like that. So it's a real good program. But it has evolved tremendously, like the work that we do. So when I was doing the degrees before diapers program, and I was in a school one time, and I said, well, where's this student was absent. They said, well, she's home because she's on her period this week. And I'm like, so she has to stay home. So it was like during my work in the school, I started realizing that so many girls were missing days of school, missing days of work because they didn't have the proper supplies when their cycle came. And so I started to distribute these products to them through the degrees before diapers program. So I would just bring some in, and make sure everybody had them and things like that. And then the needs just increased. Then you start noticing different things, right? So I'm like, oh, so they need some hygiene products too. They need the soap, they need the deodorant, they need the toothpaste, all this stuff. So now that has evolved into our Hood Kit program, where we are distributing these kits full of period products and hygiene supplies. We throw beauty supplies in there. I think this last batch went out, had some eyelashes in there, something cool. Teddy bears and things like that, so that the girls can experience a period with dignity, because they deserve to do so. And so that's our Hood Kit program. We partner with schools to distribute them, or girls come directly to us, or we deliver them sometimes as well. The program also has evolved too. So going back to like redefining negative stereotypes. So one of the things that we do is showcase excellence, right? So some of that good that I said that's in the hood, like if you have girls who they may have a parent who's addicted to drugs, or they may have a parent who's incarcerated, and they are taking care of the siblings and making sure everybody get out to school and they still graduate. Or you may have a girl who had a baby young, a teen parent and dropped out of school, but now she's back in school and now she's about to go off to college. So things like that, I think that girls should be celebrated for. I think that in the media, there's so much attention on the negative things that young people are doing. If you have a girls fighting on the CTA bus or something like that, people are going to share the mess out of it, But if you have a girl who just received 10 scholarships, or, she's graduating and they had a hard life and has come through that's share worthy as well. And so we have a award show. It's called the She's So Hood award show, where we acknowledge girls who are excelling despite their circumstances. So that's part of our program too. We also have Hood House. Hood House is our transitional living residence for young ladies experiencing homelessness, and that was born in the pandemic. So when COVID hit, we all was like, what in the world is this? What's going on? We were locked in our houses and things like that. And then as we started coming out, I was talking to the girls. I'm like, well, you still have to, make sure you get on e-learning, and you still have to keep your appointments. And, I was getting so many girls, and the girl told me, she was like, lady, look, I slept in the park last night. Like, I'm not thinking about, a doctor's appointment. And it was so many girls because COVID had displaced girls who were already had, shaky living situations. Because people was like, you can't come in here, it's COVID out there and all of that kind of stuff. And so we had a lot of girls in that situation. So they're sleeping on the red line train, the field house, just all these places. And so I'm like, dang, what can I do? So we got this unit from this owner of a building, Miss Amanda, who was fantastic, and she let us convert it into a space for girls. So we've had 2 girls come through and lead a program. One just got promoted on her job. She has her own place now. We've had a teen mom and her baby there, and she just got accepted into another long-term program. So it's doing pretty good. We're fundraising now to expand capacity, but we know that program works. So that's pretty much Girls in the Hood Foundation. We have She's So Hood, Degrees Before Diapers, the Hood Kits, and Hood House.
Yeah, and I didn't ask this early on, but hood isn't just the word hood. Doesn't it mean something?
It does. It means healthy, optimistic, outstanding, and determined. So that was our other way of kind of remixing what people think about when they say the word hood.
Yeah. Yeah. So we've interviewed a ton of nonprofits, and a lot of times the nonprofits programming or providing things that aren't being provided by whatever communities they're serving. So if Girls in the Hood wasn't a thing, what would be the landscape for these young women in schooling and out of schooling? Would they just, there wouldn't be any resources provided by the schools or the government, the city? What would happen if that were the case?
Well, I think in Chicago, we're blessed to have a lot of passionate people with different projects helping out with the youth.
Yeah.
So, but in terms of the need that we feel, I don't know many places where girls can call up or, send something over, and then 24 hours later they get this basket full of supplies that they need for free, Yep. So I think that would be something that would be lacking even in the schools. Sometimes you have teachers and principals who make sure there's some products there, but it's probably, limited. So we work with schools to provide that for the girls, because one of the things that people forget about is also underwear the girls need when you're talking about period poverty, which is a lack of supplies, and also uniform pants, and so if you have a girl who didn't have the adequate supplies and she have a accident in class, and now she has to wait till mom get paid in 2 weeks or dad get paid in 2 weeks, you just can't take it for granted that people are able to just go out and replace these things. And so, Again, that's a need that we feel all the time. So I think that without Girls in the Hood Foundation, that a lot of girls would be without the supplies and even just like the education, being able to come and just ask questions about your cycle. What does this mean? Why is my body changing like this? And, and all of that kind of stuff, because even if you have a good relationship with your child, that doesn't mean that they want to talk to you about certain things,
Yep.
and that's just how it's always been. And it's not a dig on the parent, so.
Yeah. Yeah. How have you seen this reproductive health in sex education change or improve or not improve over time, over the past, 5-10 years?
I'm happy to see.
Yeah.
Oh, in schooling,
or just in general too.
Much change in the schools, but I know there has been a lot of lobbying for things to change in the school, and kudos to those who are doing that. But in terms of community, I think that I'm happy to say that there are more programs that's out here than 5 years ago when I first got started. And people go to great lengths to make sure that these programs are just like we do, medically accurate, comprehensive, inclusive, of everyone. And a lot of the times, like back in the day, they maybe used to bring that television in and play a video, or it was mostly all about scaring you. If you do this, you're going to hell, or and things like that, and not really talking about the full thing of pleasure. Or just all of the things that come along with it. And so I think that there has been great strides in that. So the issue has been just connecting with the young people, getting it out there, I think one of the things that, not I think, but I know one of the things I love about our organization and our director, Ms. Venetia, is that we have a no judgment zone at Girls in the Hood Foundation. So you can come talk to us about anything and everything, and they do. Believe me, they do. But yeah, without getting that judgment back,
Yeah.
and so
Yeah.
that's a great thing too. So yeah.
Yeah. Not. Yeah. It sounds like prior to this, not many people had the ability or the space to share that and to ask these questions, or else they wouldn't be coming to your organization with a lot of these questions if they're already answered. Well, okay. So one big thing happened. I think you said this past week that you wanted to share. I'd love to hear about it.
Yeah, so we opened so prior to this moment, the programs that we were distributing or implementing was basically coming out of me and my hood mobile. It's a van that I call the hood mobile. I would pull up to schools. In the summertime, I'll just pull up and open the trunk. I had supplies there. You need pregnancy tests, you need condoms, you need this, you need that. And then maybe we did get a chance to rent a space a couple of months ago, but now we have our very own space that we were able to purchase, and it's a reproductive health center now in the Grand Crossing community where girls can actually now come in, and you have to come see it one day. Like, we made sure to go into the details. We wanted it to be beautiful in the inside for the girls, because we want them to feel that. So when you walk in, you have our big logo, a new logo, and we want them to feel affirmed and know that this is a space just for them. So we're really excited about having a center that's dedicated to just improving outcomes. And we've only been open. We opened Monday,
Wow.
and yesterday we had like this groceries for girls, where we passed out maybe 42 bags of grocery just filled with fresh food and meats and things like that to girls and to the community. We've done another community love day. So we've just been working it since we
it sounds like it.
Yeah. So, but we're really excited about it. It's been a long 5 years, and we're grateful to have received the support to do this.
Yeah. What do you hope Girls in the Hood grows into in the next 5 years?
Yeah, in the next 5 years, I would like to have a location in Inglewood and on the west side. And then after that, we're going national. I think it should be a Girls in the Hood chapter everywhere, all around the country.
Yeah. And do you think your programming is set in a way that it could easily scale into different aspects of the country?
I think so. I mean, we certainly see that there's a need everywhere, right, for our services. And so now that we are in the actual space, and now we're getting things structured, because it's a different ball game now from when I was riding around and and all of that kind of stuff, posted up at the library. One time we even had a degrees before diapers cycle at the McDonald's, because we couldn't afford to pay anywhere to go. So. Yeah, I think once we get everything structured, it's absolutely going to be scalable.
Wow. Next step is engagement. So what type of engagement do you look for in others, whether it be individual contributions, people giving their time, talent, treasure, testimony, or partnering with organizations? If people are listening and want to get engaged, what are you looking for?
Well, of course, we're always looking for donations, which people can do that at girlsinthehood.com. And we also have Venmo and all that good stuff. But in terms of like partnerships, anything that would provide our girls with an opportunity to explore something. So if somebody wanted to sponsor a college trip, for the girls, or a cultural tour or an outing for them. We would love things like that. Hood kit drives, a lot of people do that for us. Like, they can host it. You can make it themed to your birthday or whatever. You ask people to bring soap and towels and all that kind of stuff that we need. That stuff is on our website too. And then volunteering for sure. We also have Hood Closet. That's where we put out, like, we often get donations of clothing and baby things. So we on Fridays have everything set out. People can come in, look through it, see what they want, especially like our girls who have job interviews or internships, and they don't have the appropriate clothing for that. Hood Closet comes in handy. So we're also looking for donations of gently used or new items as well. Gift cards always come in handy. Sometimes we receive like e-cards from like Target and Walmart, stuff like that. So diapers, because we take care of young parents. So many ways to get involved with the hood.
Diapers, yes. Diapers are required. Yes. Yeah, we just had our kid a few weeks ago, so we're thick in it right now. So definitely diapers are key. Awesome. So I think we covered it. So the past, the current state, and the future. Is there anything that we missed or anything that you want to leave us with before we wrap up this episode? Of course, first, before you answer that question, actually, where can people find you on the internet?
They can find us at girlsinthehood.com, and that's GYRLS. We're on Facebook, Instagram, Twitter, under the same name. So we're pretty, we're pretty out there. So, and then from there, you can just hit the contact us button if you want to send a message or ask a question, and it'll come to me directly.
Perfect. And then lastly, is there anything we missed or anything you want to leave us with before we close out this episode here?
I would just encourage your listeners to take care of girls, look around, and just have a little bit more tolerance, for them, and a little less judgment. So if you're lucky enough to have a teenage girl in your life or no one, give her a hug, some encouragement, some support.
All right. Well, Chez, thank you so much for your time this afternoon. We're honored to share this work. I don't think we've ever interviewed an organization focused on women's reproductive health. So very honored to share this story and to drive engagement and awareness and hopefully get some more people involved.
Yeah, thank you. I really do appreciate you having us on today.
Thank you so much. Thanks for tuning into this episode. If you know of a great organization or individual leaving a positive impact, we'd love to tell their story. Check us out and contact us at gtzp.org. Don't forget, for more stories like this, you could also follow us on Instagram, Facebook, LinkedIn, and YouTube. Instagram followers, our link trees in the bio. And for podcast listeners, we're on Apple Podcasts and Spotify. Thanks for listening, and see you again soon.